Hi, my name is Carl Khan. I'm a physiotherapist at the London Back Pain Clinic.
And I'm Roy Hamoud, chiropractor at the London Back Pain Clinic.
And today we're going to kind of talk a bit about our practice and how we kind of work together a bit as a team. A lot of the time, and I kind of speak for yourself here, kind of Roy, I bet you get the question, well, what's the difference between kind of chiropractics, osteopaths and physiotherapy? What do you kind of say to them?
Well, the first thing I say is the spelling's different, right? I always start there.
There's a big difference.
Because, it's important, right? It's an important difference. But really, I feel like as the professions have progressed, there's more similarity amongst all of them compared to differences.
I do struggle to answer that question all the time. It's a bit like, you have to kind of, well, they kind of do a little bit of this and they kind of do a little bit of that.
Yeah, so I mean, you're assuming that the patient's asking from a technique perspective. So they'll come in and say, what's the difference between chiro and physio? And they're sort of assuming we do different things.
I think they're looking for a distinct difference, though.
Correct. Well, and for them, that's technique, or that's sort of type of treatment that they expect to get, right?
So what differences do you think, then?
In terms of practices or therapies? Well,
particularly between chiropractors and physios?
Well, it's a tough one because we overlap so much, right? So we both use our hands. We're both manual therapists in a sense. Chiropractors generally are known for spinal manipulation, but physios manipulate as well.
Yeah.
But
I know some really good chiropractors that are good rehab specialists.
There you go. Well, I refer my rehab patients to you.
And I tend to refer patients for manual therapy to yourself.
Well,
they always seem to prefer you, though, because, I tell them to do exercise and you
don't.
Make them feel good afterwards.
Well, correct. So, but that's the core of the issue, right? It's not about what the difference is, it's how we can work together, whoever we are. Whether I'm a chiro or you're a physio, how can we because we're a team, how can we put it together and give the best sort of possible outcome to a presenting patient?
Yeah, because I do find, like, in my practice, is that if someone's seen a chiropractor, there's always seems to be and then they come to see myself, there seems to be a conflict between the two of us, if that makes sense, and there seems to be like a tennis game, like a bit of a to and fro. Oh, but my chiropractor said this. Oh, my physio said this.
Yeah. Well, let me tell you where that comes from. Chiropractors generally perform passive treatments. So we're very hands-on. There's nothing wrong with it. But there's always that next step for a patient to sort of promote function and to sort of get them independent, which requires them to do work. Well, yeah, but that's the hard part, right? And that makes your job A, harder, but B, more important, right?
They just think I'm some sort of physical terrorist, kind of whipping them into shape.
Well, I beat them up too manually, I don't.
They come out feeling nice and,
Well, maybe not during. So maybe they're more relieved as a result of sort of. Because I do work them through it, and I do remind them to do their exercises. I always ask patients that have been to see you, what has Carl given you? Are you doing the exercises? They'll probably say no. A lot of them say yes, and I always remind them that you should do them. You should do them, right? So,
definitely. So you're in agreement, though. I would say chiropractors might be a little bit more manual. Physios tend to be a little bit more on the rehab side, but there is definitely
exactly. It's a grey area. It's not a black and white. There is overlap there, but I mean, sometimes you have to draw those lines in a multidisciplinary practice.
I think the advantages that we have as a team is that there is no confusion, if that makes sense. There's a treatment plan, and it kind of, I guess, installs trust in the patients. Would you not agree?
Yes, exactly. So they know why at least they know they have a plan or a sort of plan of progression. I mean, the way we work is they generally see you first. They're assessed by you. You give them their exercises, watch them progress for a bit. If they're stuck, you can send them to me for you. Or if you feel they need something more sort of hands-on.
Sometimes if I feel like they're stuck, but sometimes I feel like if they could benefit from your treatment, I'll send them after the first session, and then I may see them in a few weeks to progress their exercise and see how they're going.
Correct.
But I kind of like it because it means that they know when they come and see myself, you know, they're seeing me for exercise and they're seeing you for the manual thing. So their expectations are already set. They know what to expect, sort of thing. And so there's no confusion. Like, it does mean, like, say, for example, you know, I don't have to rush, you know, to get the exercise done to then do the manual therapy session, and then, you know, I can't get the best out of both worlds, if that makes sense.
Exactly, and likewise. So I can focus on the manual side of things without having to worry that I have to sort of finish with them, get them sort of ready, do some exercise on the floor, and, you know, they need to get out before, you know, the clock strikes, you know, 5 or 6. So,
and I think we've personally had some good results.
I think so. I think it works well. And sometimes I give them the story of, as you know, my back injury. So I injured my back about 2 or 3 years ago now, and you saw me, you watched me through my progression.
Makes you relatable.
Exactly. It makes them know that they're not alone. They're not the only ones that have this problem. They can get better from it.
Because it's easy for us to say that, you know, this is back pain. It may go, you know, it can go away. You got to do this. You got to do this. But if you've not been through it yourself, sometimes it is. They can't see that you're going through. You've been through their shoes in a way, and you don't understand.
Exactly. It's more relatable as opposed to textbook.
There is massive similarities between the two. I think it's more the fact that society kind of has dictated that maybe chiropractors might be more for the spine, even though you do extremities like your knees and ankles and shoulders. And physios tend to be the kind of guys that give you the exercise, but sometimes, you know, we'll do manual therapy, and whether the kind of chiropractors are more manipulation based, while maybe physiotherapists may be soft tissue based or mobilization kind of based. Would you not agree?
No, I agree with that, and that's sort of the general. I feel like that's what patients generally feel if you sort of ask them outright. You know, what do you think a chiropractor does versus what do you think a physio does? You know, but that's where our role comes in. You know, where we have to educate them. So they may come to me for a back problem, but I can, I may have to educate them and say, actually, no, you can see a physio. You know, physio works just as well for backs, or, you know, you might need sort of a rehab specialist. Go see someone else.
And that's why it's such a great thing, because we have trust between the team. So I feel very comfortable and able to kind of refer to you.
And I can sort of refer back to you, you know, so I think it works both ways. And I think the ultimate goal is we give the patients as much, as holistic, and I don't like the word holistic, but as holistic an approach as possible.
Yeah,
so,
make them the center of the treatment.
Exactly. And it might not just, I mean, we're talking about us, but there are others involved. So we've got a podiatrist. If you feel that a patient might need a biomechanical assessment, we'll send to Alicia. If you feel like they need something else, you'll refer
feel like
outward.
They may need some CBT therapy, we send to Sean.
Or to a specialist, you know.
The importance really is having the team, having the multidisciplinary.
Correct.
Team.
Absolutely. I think that's the key importance here. It's
we shouldn't be separating the skill set. We should be combining them.
Absolutely.
Anyway, I think that's a good way to finish, guys. Yep. I hope that's helpful. You take care.
Have a good one.